Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid (CSF) within the ventricles of the brain, leading to increased pressure. This can cause various symptoms and complications due to the pressure exerted on the brain tissue. Here are some key points about hydrocephalus. Types of hydrocephalus: cone and hydrocephalus, present at birth and often associated with genetic abnormalities or developmental disorders, such as neural tube defects like spina bifida. Acquired hydrocephalus develops after birth due to factors such as infections, for example, meningitis, brain tumors, head injuries, or hemorrhages. Communicating hydrocephalus, CSF can still flow between the ventricles, but it is not properly absorbed by the bloodstream. Non-communicating obstructive hydrocephalus, blockage within the ventricles prevents CSF from circulating normally. Symptoms: these symptoms of hydrocephalus can vary by age group. Infants: rapid increase in head size, bulging fontanelles, vomiting, irritability, poor feeding, and seizures. Children and adults: headache, nausea, vomiting, blurred or double vision, balance problems, lethargy, changes in personality or cognition, and urinary incontinence. Diagnosis: Hydrocephalus is typically diagnosed through imaging studies, such as ultrasound, often used in infants. Computed tomography (CT scan) helps visualize the ventricles and detect blockages or abnormalities. Magnetic resonance imaging (MRI) provides detailed images of the brain and ventricles, helping to identify the cause and extent of fluid accumulation. Treatment: main treatments for hydrocephalus involve surgical interventions to divert the excess fluid. Shunt system, a common treatment that involves inserting a flexible tube into the ventricles to drain excess CSF to another part of the body, such as the abdomen, where it can be absorbed. Endoscopic third ventriculostomy (TV), an alternative procedure where a small hole is made in the floor of the third ventricle, allowing CSF to bypass the obstruction and flow toward areas where it can be absorbed. Complications: if left untreated, hydrocephalus can lead to significant complications, including brain damage due to increased intracranial pressure, developmental delays, and intellectual disabilities in children. Physical disabilities and difficulties with balance and coordination, vision problems, and potential blindness. Prognosis for individuals with hydrocephalus varies widely depending on the cause, severity, and effectiveness of treatment. Early diagnosis and appropriate management are crucial for improving outcomes.